correctly diagnose a patient, you need to gain information from the patient. First off, you need info on the present illness of the patient, when it started, any change in diet or behavior, etc. Family history is also very important. From the family's history, you can learn if there are any genetic diseases that might affect the patient, or if the patient has been in close contact with any sick people. As you may already know, whenever you visit a doctor, they examine you. This will include a physical and questions. A doctor will be able to gain valuable info about how you are doing through this examination, but sometimes a doctor will need to run tests. This is because a doctor is not always able to see how your body is doing from the inside. After going over all of this info, a doctor will be able to diagnose a patient. In this video, we will go through this case using a real-life case. A 10-week-old female comes to the ED. She has been sleeping more and is less playful, with increased work breathing. The toddler is diaphoretic and tachypnic during feedings and requires multiple rest periods before she finishes her feedings. Doctors are told that the parents have no significant health history and that her older sibling is healthy and no one was recently sick. On arrival to the emergency room, the infant's temperature is 98.2 degrees Fahrenheit. Her respiratory rate is 65 breaths per minute. Her heart rate is 165 beats per minute. Blood pressure is 92/68, and pulse oximeter shows 99% on room air. The baby is mildly thin, pale, lethargic, and tachypnic. She has no significant skin lesions. Upon medical examination, her heart appears to be abnormal. A hollow celistic murmur is heard. This might mean that there is an issue with the heart valve or the wall between your heart's lower chambers. Her abdomen is soft and not tender. The liver, though, does appear to be enlarged. No masses are felt and extremities are symmetric and cool. Capillary refill is 3 to 4 seconds. Multiple tests are obtained. The complete metabolic profile is completely original, while the complete blood count shows an elevation in the white blood cell count and in hemoglobin. The chest radiograph shows moderate cardiomegaly with mild pulmonary edema. The EKG shows an abnormally fast heartbeat. The patient has many of the symptoms associated with cardiac failure. The patient has tachycardia, poor capillary refill, hepatomegaly, and lethargy. An echocardiogram is needed to evaluate any underlying structural heart disease due to the examination results. An echocardiogram is obtained and it demonstrates a large paramembranous ventricular septal defect. This can be associated with increased pulmonary flow and increased work breathing. Infants with a large ventricular septal defect and congestive heart failure are candidates for surgical repair. Prior to the surgery, growth is promoted by high-calorie feedings, ACE inhibitors, and/or digoxin. The surgery is often performed when an infant is between 3 to 6 months of age.